afternoon. Welcome to the Corporate Health Series from Apollo Hospitals. This is Dr. Srinidhi Chidambaram here. The series is aimed at creating an awareness about a host of health-related topics ranging from wellness to lifestyle advancement to prevention to giving you the news on the latest medical advancements and innovations. We know that amidst a hectic and stressful corporate career, you may not have the time to know key facts about health and disease, so we make it easier for you to have this information at your fingertips so that you can take effective steps to keep yourself and your family healthy. So today we are going to talk about a disease that is often seen as frightening and one that invokes a feeling of dread. Cancer. But what we need to know is that today cancer is conquerable and it is no more a disease that is to be feared. There are many things that you can do to lower your risk, detect the disease early, and there are also many advanced options available today to ensure survival and a very good quality of life. So today we start with the basics of what cancer is and move on to common types of cancer. Cancer is the uncontrolled reproduction of cells due to defects in the genes that normally drive and stop cell division. Many different things can cause the genes to become damaged or mutate, and then they can no longer function properly. And these many different things can range from radiation, environmental chemicals, viruses, chemicals formed inside the body. But you can lower your risk of getting many common types of cancer by making healthy choices, screening tests that can find some cancers early when the treatment actually works best. And vaccines also help prevent certain types of cancer. So today we are going to discuss a very common type of cancer in women that is eminently preventable and treatable. Cancer of the cervix. The cervix is the opening between the vagina and the womb or the uterus. It is the lower part of the womb really. It's also called the neck of the womb. And this cancer is often prevented by screening, which aims to find and treat changes in the cells before they develop into cancer. It's also one of the cancers that has a protective vaccine. So to give us the expert view on cancer of the cervix, I am delighted to welcome Dr. Pakhee Aggarwal. Dr. Aggarwal is a highly experienced gynec oncologist and a robotic surgeon with over 2 decades of expertise. She currently serves as a resource faculty trainer and clinical examiner for the Royal College of Obstetricians and Gynecologists, the RCOG in London, and the Indian Council of Medical Research, Noida. She demonstrates a commitment for academic excellence and training the next generation of healthcare professionals. Furthermore, she is a member of the expert pool of European Commission Initiative on Cervical Cancer, an initiative of the WHO IARC to reduce the burden of cervical cancer globally. She's also part of the expert group in formulation of national guidelines on cervical cancer screening and HPV vaccination, which are followed throughout our country. Her clinical practice at Apollo Hospitals, New Delhi, focuses on minimally invasive surgical interventions for a wide range of gynecological conditions. This includes robotic surgery, hysterectomies, uterine tumors, ovarian masses, endometriosis, and fertility-sparing procedures, along with pelvic surgery and radical hysterectomy for gynecological cancers. She's also adept at managing precancerous lesions, conducting gynecological cancer screenings, and treating heavy and painful periods through colposcopy and other minimally invasive techniques. Dr. Aggarwal firmly believes in a holistic approach to patient care, emphasizing preventive education and timely management of illness. Can't think of a better expert to give us a complete overview on the cancer of the cervix today. Welcome, Dr. Aggarwal. Thank you so much for joining us.
Thank you, Dr. Srinidhi.
So let's begin. For our viewers who may not be very familiar with this term, What is cancer of the cervix?
Right. So, as you already highlighted, cancer means that the cells are growing abnormally. Normally, cells would grow and they would die off. But what happens in cancer is that they don't undergo natural death. So, they keep on proliferating. So, it's an uncontrolled growth of cells. And then, when we talk of cervical cancer, or as some people also say, cervical cancer, both connotations are correct. These changes are happening in the mouth of the uterus. So the uterus is a pear-shaped organ. At the top of it lies the cervix or the mouth of the uterus, or we also call that the neck of the womb, where it leads into the birth canal. So cervix is that part. It's the lower part of the uterus, which is connected to the uterus directly. And this is also what opens up when somebody is going to have a baby and deliver. The cervix dilates and the baby comes through. This is also the part that we screen for when it comes to cancer. Now, this cervix, it has an inner lining and it has an outer lining. Those two linings are different. And what happens is there is a kind of constant breakdown and growth occurring at the junction of these two linings, the outer one and the inner one. And it is at this junction that sometimes this breakdown and repair process goes haywire. And at that point is where it turns into cancer. This zone, we call it transformation zone medically, but that's suffice to say that a lot of cellular changes happen at that level. And if that goes haywire, then it can turn into cancer.
So, is this cancer very common, particularly in India? What is the incidence?
So, cervical cancer is becoming the commonest ones. It is the second most common when we talk of Indian women after breast cancer. But when we look at the global burden, there are 634,000 cases. But 1/4 of these are contributed by low and middle income countries, and India is part of that. So Southeast Asia region and Africa contribute a large part of the global burden. So almost a fourth of the global burden, almost about 134,000 cases are contributed by India. And the death rates are also disproportionate. So while not many who develop cervical cancer in the West will die, the death rates in our country are much higher. So almost 45,000 deaths a year. We say that one woman dies of cervical cancer in India every 9 minutes.
That is indeed a grim scenario. Is that because of the late detection or the late treatment that the survival rates are kind of?
Partly, yes. Partly because the incidence itself is higher, because it is in part related to certain lifestyle practices. And we will come to that subsequently. But because those are common in India, so it's commoner in India, as well as late detection, of course, because this cancer occurs also in postmenopausal women. And most of these women, if they have any problem, they are kind of reluctant even to mention it. So those are the cases we see more at the advanced stage. When it's the younger women we are talking about, most of them are aware. They know that if some kind of bleeding is happening, which shouldn't be happening, they do meet up with a doctor. But women who have gone through menopause think that maybe it's just part of menopause, or so they tend to ignore these symptoms.
So, what are the chief risk factors for someone to get cervical cancer?
Right. So, of course, cancer has a mind of its own. But having said that, the commonest risk factor that is associated with cervical cancer is HPV infection. It's a viral infection that is transmitted through intercourse and through close, intimate personal contact. And it is not just merely getting this infection that leads to cancer. It is this infection remaining in the body for a prolonged period of time, meaning the body's natural immunity not being able to clear it off as it should, and this then going on to cause changes at the cellular level. So the virus starts mixing with the host cells. It causes certain mutations in the DNA. It causes changes at the DNA level, and that's how the cell division starts becoming uncontrolled. It doesn't get suppressed. So that is the commonest, which is associated with cervical cancer. Almost 90% of cases would have had an HPV infection, which did not get cleared by natural immunity, which persisted, basically.
So, what would be the symptoms of this HPV infection in women? So, when should they get
That's an excellent question
looked at?
because although it's a viral infection, and we all know what viral infections are like, they'll bring up, a little bit of sore throat, feeling unwell, headache, maybe body aches, maybe a mild fever. HPV is one of those viruses. When you catch it, there are no symptoms. So you wouldn't know that you have acquired HPV. And the only means to detect it is by means of a test that we do in the clinic, in the OPDs. We take a swab from the cervix and we look for the HPV virus using RT-PCR or such technology. And that is how you would know you have it. You would not know because when it enters your body, you would not have any symptoms.
So the only way is to go for a screening.
That's right.
So is there a particular, you were saying that HPV is associated or contracted through intercourse. So what we might as well talk here a little bit about what your advice would be to or for couples regarding safe sexual behavior, and is the only way to actually prevent this?
Right. So while we were talking a little bit, I'll just go back a little bit. When we were talking about the causes of HPV, of cervical cancer, I said HPV is the commonest, but then there are a host of other factors which are also linked to the same thing that you are asking me. So, having multiple sexual partners, starting intercourse at an early age, having poor personal hygiene, smoking, alcohol, having poor immunity in general, having contracted HIV or AIDS, which lowers your immunity, those are also risk factors for cervical cancer. So as you can see, they are all linked together. They are linked somewhat to the sexual practices, the other risk factors. So yes, to mitigate that risk, one would need to practice safe sexual practices. Now, of course, using a condom will protect you also against other sexually transmitted infections, not just HPV. And sometimes when it's a combination of infections, the body finds it very difficult to clear HPV, vis-a-vis if you didn't have any other infection. So, of course, the barrier protectives will protect you against that. But it will also spread through intimate personal contact. So, for example, oral sex will also transmit it. And so one needs to indulge in safe sexual practices. Monogamy is a thing that here medically would actually help you if you have one partner and your partner has just one partner, because then it's very unlikely that either of you would have contracted it, because that's the only way it actually spreads. So yes, I think it makes a case to follow safe sexual practices to prevent cancer in this case.
Is there also a familial element to cervical cancer?
About 5% of cervical cancers can be due to faulty genes. We haven't identified all the genes. Like for breast cancer, we know there is the BRCA gene, and there has been a lot of talk on social media about it, because when prominent people develop it due to that gene, it comes in the limelight. Like cervical cancer did come in the limelight for some reasons. But yes, so like we have very strong genetic association with some of the other cancers like breast cancer and ovarian, where the risk is much, much higher. With cervical, there's about a 5 to 10% genetic component. It's seen in certain populations, it's more common. In one of the Swedish cohorts, it's more common. But by and large, it is more often, is it acquired, not so much genetic. There is some genetic element, but not a lot, as we know for other cancers.
And what would be the common age groups that it strikes?
Right. So cervical cancer is one of those cancers which has a bimodal age distribution, meaning it's common in two population subgroups. The first is between 30 to 35, because sexual activity would have started, say, around 20, and it needs about 15 years of exposure. If you have acquired the virus, it needs that much exposure. So we see cases which are common in that age group, 30 to 35. And the second one we see is around 60 to 65 or 70 years. So the postmenopausal ladies, whom it could also be due to HPV, but sometimes it's not related to HPV because, unless they've had a new partner and something has led to a new infection. So we see a kind of bimodal distribution with this cancer.
So in the postmenopausal women, if it is not the HPV, are there any other risk factors?
In postmenopausal women, if you have diabetes, if you have blood pressure, if you're smoking, if you have low immunity in general, you've got kidney diseases or liver diseases which are impairing your immunity, those are also risk factors. And of course, poor personal hygiene and not paying attention to the symptoms that one gets.
So we now come to the perhaps the most important part of this discussion, which is really the early detection. And because, especially as you said, that sometimes these symptoms or even HPV infection is asymptomatic. So, what would your advice be on the role of screening? What are the tests which are available, and how often or at what age should women start having them?
So screening basically means we are trying to detect disease when you don't have symptoms. That's the ideal time to do screening. Once you have symptoms and you've gone to a doctor, then we are just diagnosing. Screening is a preventive tool, right? So now like I said, we test for HPV in the cervical swab. We also test for other things in the cervical swab, and that is called a pap smear test. And we look for changes which are occurring at the cellular levels, irrespective of HPV. So there are changes in how the cells are looking, how big they are, how swollen they are, and how irregular they are. All of these things are looked at under the microscope, right? So the pap test is going to do two things. It's going to look for these cellular abnormalities, as well as it will look for, are these cellular abnormalities due to HPV? The ideal age to start screening is 25 years or 3 years after the onset of sexual activity. So that there are two here because everyone would not have started sexual activity at the same age. So we say if you have been sexually active for 3 years or more, that is the time to go ahead and get a pap test. And then we repeat it every 3 years until the age of 50. After 50, if your smears have all been normal, they have no problem has ever been detected, then we reduce the screening to every 5 years, from 50 to 65. And at 65, if you haven't been detected with cancer, then we do stop screening at that point because it doesn't make sense to endlessly screen. You would have developed some or the other problem in the interim. When we use the HPV test to screen, and this is very interesting because in the West, women can do their own HPV test. Kits are mailed to women, and you can take a swab of your vagina. It doesn't have to be from the cervix, and you mail that back to the lab, and it's tested for HPV. Now, HPV testing, we don't need to do as frequently. We can do it every 5 years, and we start that from 30 onwards. We don't start it at 25 because it's not just HPV, it's not transient HPV we are worried about. So say you got it at 28 and at 29 you were free of HPV. We wouldn't start until 30 because we're only concerned with the HPV that is persisting and beyond the age of 30 years. So when we do that, then we do it every 5 years. So those are two screening modalities. There are a few others. Of course, in a corporate setup, you may not get those, but in the periphery in India, where it is quite common, this cancer, there's a very simple test where we apply dilute vinegar to the cervix. And if it has some abnormal areas, they're immediately highlighted. So it's a kind of a low resource test, but very cost effective in populations where you don't have a lab and you don't have trained people to read the lab sites.
So, assuming that the pap smear comes up with something abnormal, what is then done?
So if the pap smear shows something abnormal, then we have a test which is called a colposcopy. And what we do in that is we take a very close look at the cervix. We use special lighting. We use magnification. And we look at the cervix almost at 40 times magnification. So anywhere from 4 to 40 times. And we try to look for where could these abnormal cells have come from. They have come in the pap, so they're coming from somewhere in the cervix. Cervix is a big 360-degree thing. So then we look at every quadrant very closely and we use certain dyes again. One of them is liquid vinegar, diluted vinegar. The other one is an iodine-based dye. And that helps us with the magnification, with the lighting, helps us to look very closely. And if we find something, some area which shouldn't look what it looks what it shouldn't look like, then we remove that area and we send it for biopsy. So that is the second test which we do when we detect something positive.
So one cancer where we have been also quite aware of is the vaccine. And what what vaccine works against cervical cancer, and what would your advice be for women? When should they take it? Should everybody take it? And so on.
Right. So incidentally, there are only two cancers which can be prevented by vaccines. The other one is liver cancer. And this is just for people out there. Hepatitis B vaccine protects from liver cancer. And the only other cancer which is vaccine preventable, the rest of them are not, is cervical cancer. So if you have such a powerful tool as this to prevent cancer, and it has been, the vaccine, what it does, it targets the HPV. It prevents HPV from gaining a hold in your body. You would get the infection, but the vaccine will not let it. So it's a preventive, it's a prophylactic vaccine. It prevents HPV infection from taking a hold in your body. Now, these HPV vaccines are not new. The first vaccine was licensed way back in 2006. The second one in 2009. They were all licensed in the US, and there were huge trials that went on looking at the safety and the efficacy and all of those before they came into public use, and the FDA approved them 2006 onwards. Right, in India, the uptake was slow because when the program was started about 5 years ago, some unfortunate uh, mishaps occurred. The populations that were vaccinated were in the Northeast, and some mishaps occurred, and they were erroneously attributed to the vaccine. Of course, later, all the research that went in said that they were not related to the vaccine, but that kind of put our program for vaccination to a standstill. Of course, I think it will be revived now again. So now comes the age of when to take the vaccine. The earlier, the better. The idea is to have enough immunity, enough antibodies in your circulation, so that when the HPV enters your body, it's able to fight it off. Right? So now the onset of sexual activity can vary within our population. It can be young, it can be as young as even 15. Unfortunately, it can be 20, it can be 20, it varies. So we say the ideal age to vaccinate is before the exposure to the virus, from 9 years onwards. So it's actually a pediatric vaccine, 9 years onwards to 25 years of age. So the earlier you do it, the better immunity your body generates to it. You can even vaccinate. There is, in some populations, vaccination in the US also. Women up to the age of 45 also want to be vaccinated. They feel that this vaccine came now, we're 35, let's just go ahead and get vaccinated. Why should it be only for the younger population? So that question often comes in our mind, and I do get a lot of patients who now are very aware of the vaccine, and they feel that, okay, we've already had 2 children. Should we take the vaccine? So when we give it at the age appropriate time, where there is no HPV in the body, the efficacy of the vaccine is something like 95 to 99%. Very high efficacy for any vaccine. When we do it, when someone has already been exposed to the HPV, it does not get rid of that HPV. It does nothing to that HPV, but it protects you from getting other strains of HPV. So you could take it later, but the efficacy, which was 95 to 99%, is going to come down to 70%. It's not zero, but it will come down. So that the ideal, and the government also said the ideal age is 9 to 14.
And how many doses of that would?
Now, about the doses, when all this, everything started, when we started giving HPV, it was always 3 doses. First dose, second dose a month or 2 later, and the third dose 6 months later. We got more data, we got studies going in, we got there, because across the world, there are countries which don't have so many resources to give 3 vaccines. So there were trials by WHO, there were a lot of country trials. We came down to 2 doses. And we came down also to 1 dose. So if you vaccinate between 9 and 15, even 1 dose shows the same immunity, the same benefit as was 3 doses in the past. Between 15 to 20, also the WHO says you could take 1 or 2 doses. It's only those who are above 20 need to take 3 doses. And of course, if you are above 26, then you do need to take 3 doses. Or if you have immunity problems, if you're low in immunity, then you've still got to take 3 doses. So it's come down to 1 or 2 doses in girls who are less than the age of 20. Makes it convenient, makes it affordable.
So what would your message be for corporate employees who may not prioritize or may not be aware so much about cancer cervix of all things. They might undergo screening for their sugars or for their, if at all they do. So, what would you like to tell them about cancer cervix?
I think most of the corporate wellness packages do include a pap smear. We're just hesitant to get it done for whatever reason. So if if you have never had a pap smear and you're married or you have been in a relationship for 3 years or more, even if you don't have it as part of your package, go ahead and present to your gynecologist. Get a pap smear done. It hardly takes 5 minutes of your time. It's not painful. It's like an OPD gynecological checkup, and you have the information within say 24 to 48 hours. And if that's negative, then you can be reassured that I'm not, something wrong is not going on there. Same goes for testing for HPV if you're over 30.
So now I think we will move on to a situation where, somebody has actually contracted the cancer. So what would be the earliest symptoms that should alert a person to seek medical advice?
Okay, so now cervical cancer, another unique thing about it is it's not like yesterday you didn't have cancer and today you have cancer. There's a very long kind of pre-cancer stage, which can even go up to 15 years. So 10 or 15 years of pre-cancer before it turns into cancer. And during those 10 or 15 years, your body is going to give you plenty signals. You could have bleeding after intercourse. You could have bleeding just randomly in the middle of the cycle. You could have discharge that goes away with medicines but still comes back again. So you have this kind of chronic persistent infection which keeps on festering. So those are the common symptoms so your body is going to indicate that something wrong is going on. It may not be still frank cancer then, it would be pre-cancer. When somebody develops frank cancer, then generally if it's in the age group, like I said, 60 onwards, those are the women whose periods would have already stopped, say around 45 or 50. So bleeding that starts again after menopause, even if it's small in duration, should not be taken lightly. It should be immediately and expeditiously investigated. So that's one symptom of frank cancer, bleeding after menopause. Again, foul smelling vaginal discharge. In the late stages, when cancer spreads, you could have swelling of the legs. You could have swelling of the tummy. You could develop jaundice. You could develop bone pains. You could have leakage of urine from below. You could have leakage of stool or problems with either of those. So in advanced stages, all the organs which are nearby, when they start getting infected with cancer, then the symptoms start appearing according to that.
So what would be the diagnostic options for these symptoms?
So if someone presents with these symptoms, the first thing we do is we look at the cervix. So we do a clinical examination and we use a kind of a metal instrument to put inside the vagina, open it up and look at the cervix. And that generally shows us if there is a growth. If it's frank cancer, usually there's a growth which bleeds just by touching. There could be a foul smelling discharge, all of those. And then the way to confirm the diagnosis is to do a biopsy. So only a biopsy can confirm whether it is or it isn't cancer. So that's the next thing we do. We take a biopsy. The third thing we'd want to know after we have diagnosed cancer is what is the extent of this cancer? How far has it spread? So now for that, we do certain specialized tests. They could be a PET, that could be an MRI. It depends from case to case. So we do certain more tests to determine if it is cancer, then what is the stage of this cancer? So that's the next step.
And what would be the treatment modalities?
And then treatment modalities are also based on the stage. So if it's early stage cancer, which is limited to the cervix, then removing that generally, and we remove a generous amount of tissue around it, which could have been infected with cancer. So if that is removed and the margins are clear, then that itself is curative for that lady. If it's a cancer which has spread beyond the cervix, started going to the organs which are around, then surgery alone is not curative. Then we do need to give them radiation. We do need to give them chemotherapy. So it depends on the stage. So if it's very early stage, like stage 1, surgery is an excellent option. If it's stage 2 or stage 3, generally they're treated with chemo and radiation to begin with. If it's stage 4, that means it has spread elsewhere in the body. It's gone to organs like the lung or the liver. And then the treatment is basically supportive care. Because even though we may tackle the cancer in the cervix, the one which is settled in elsewhere would not be tackled by that same therapy. So it's more of supportive care.
So what do you anticipate as future advances in the management of cancer cervix? And I know that you perform several of the robotic surgeries. So what are the new surgical options and what are the other options in chemotherapy or radiation in treating this?
Right. So let's start with diagnosis first. There are a lot of handheld visual tools that have come. You put the probe on the cervix without taking a biopsy. It tells you, is it harboring abnormal cells or not? They do some kind of impedance testing of the tissue, and it's been calibrated to note down if the impedance is high, then this is what it's likely to be. If it's low, this. So those are advances in diagnosis where you cannot do away with still with a biopsy, but you can be reasonably certain that you are looking at cancer. So those are in the diagnosis that have the advances which have come. The other thing about HPV, we have started testing for all the cancer-causing HPV types. So there's not one, there's more than one. And the advances, previously we used to just test, is it high-risk HPV positive or negative? Now we get that information, it is HPV 16 or 18 or whichever other type. So that's about the advancements in diagnosis. When we come to treatment, in surgery, of course, robotic surgery is a big advancement that is very minimally invasive. In cervical cancer, it has a role in the very, very early cases, which are actually microscopic. So where you don't have visible cancer, but it is cancer, or the cases where you have cancer, you had it unfortunately at 30, it's limited to the cervix, and you want to go ahead and plan a pregnancy, fertility preserving options. So those are the ones which are best tackled by robotic surgery as a minimally invasive option to preserve fertility. When we come to radiation, there are various ways to give radiation. Previously, it used to be a block of radiation to the tissue. Now we have various modalities. We have image guided, we have intensity modulated. So all of these things which just target the cancer and try to spare the normal tissues. A lot of the toxicities with these therapies are because the normal tissues also suffer the brunt of this. So now we have these kind of modulated therapies which will just precisely target the cancer. That's in radiation. In chemotherapy, another subset of chemotherapy, what we call as immunotherapy, has also come in, and that has shown some role in the cancers which are not responding to traditional therapies. So some patients fit into those criteria. We do some molecular genetic testings. So like I said, about 5% there might be a molecular basis, and we know certain molecules kind of genetics are linked. So we try to target them at the molecular or their immune, like kind of cellular level. So then those are also advances in therapy which have come.
I think this has been a very, very informative discussion, but I would like to also, before leaving this session, ask you what you think corporate organizations need to do to help their women employees more aware, to be more aware of cancer cervix, or what steps can they actually do in the screening and prevention?
Right. So as with all cancers, knowledge is power. If you are aware and you get yourself regularly screened and we detect pre-cancer, that's the best situation. If you have to have cancer, then pre-cancer is the best stage to get it, to put it candidly. So what corporates can do actually, one is to make their women, and why I wouldn't say why just women employees, all employees more aware, because of course men will have daughters and sisters and mothers who need to know, right? So awareness is the first thing. That's first in our armamentarium to prevention, to be more aware, be aware of the risk factors, to know how to reduce those risks. That's all primary prevention. Of course, HPV vaccination in the age appropriate cohort, if corporates offer that, then that is an added bonus. Also acts towards primary prevention. When we talk of secondary prevention, it is screening and detecting problems early. So if women are aware and they come for testing, or if you are doing as part of an annual health package or a checkup, you offer them pap smear, you offer them a gynecological consultation where they can discuss their concerns. That works towards secondary prevention. And tertiary prevention is if there is a problem, God forbid, if that does happen to someone, then of course corporates can support them through their cancer journey in ways more than one. They can help with their therapy, with their counseling. A lot of these patients need a lot of psychological support. So I think corporates do have, because that's where someone spends nearly half their life, isn't it, in their workplace. More than half, I would say.
It's really lovely when everybody supports each other also and helps them.
That's very important for a cancer patient's recovery, psychological.
So thank you so much, Dr. Aggarwal, for this wonderful session that has been so informative, yet so concise and so clear. Thank you, viewers, for joining us today, and I do hope that you found this session useful and informative. The key takeaway from this session is that cancer cervix is one cancer where we have a lot of tools, where we have a lot of knowledge that can stop it from being a threat to the health and well-being of women, their families, and communities. We hope that we have communicated this message to you very clearly. We hope that you will adopt all the preventative steps that Doctor has outlined today that can halt this cancer in its tracks. Remember that your health is an investment, it is not an expense. So take time out for it. Take simple, small steps to protect yourself from diseases that can hugely impact your productivity, your success, and your well-being. Make health a priority task. See you next time. Take care. Namaste and thank you.